Joe, so great to have you in the podcast. How are you today?
I'm great. Great to be here. Thank you, Jared, so much, and excited to have a good conversation with you today.
Likewise. Let's kick things off. So first off, first time on the show. Really excited to have you here. Let's have you give a quick background on yourself, and then lead that into an overview of Freespira for those that have never heard of it. Let's assume there's a portion of the audience that is hearing about you for the first time.
Mm-hmm.
Give us that overview. But first, let's hear about you and then go into that.
Great. Yeah, thank you. And again, I'm really excited to be here and to share our story with what we're doing at Freespira. I'm Joe Perekupka. I'm the CEO of Freespira. And Freespira is a behavioral health treatment that is delivered to the patients directly at home. I think what's critical for everybody to know is Freespira's approach is uniquely different. We're really addressing anxiety disorders, specifically the symptoms associated with panic disorder or PTSD. And our unique solution allows us to deliver the product directly to the patient at home. It's done in the privacy and the comfort of their own home over the course of 28 days. And what we hear from a lot of patients is they love the alternative solution for treating their symptoms because it's non-medication based.
So when we think about PTSD, so why does that continue to be kind of a core focus? And then I know you mentioned a little bit in the overview, like where do you see things heading from here?
Well, the reason we're focused on panic and PTSD, and we've really kind of leaned in heavy on PTSD is because, well, first off, they tend to be under-recognized disorders that they're seeing within the mental health landscape. We originally started with panic because oftentimes there's a high rate of undiagnosed panic patients because it's often accompanying another comorbid condition or a chronic condition, right? So oftentimes those individuals are just suffering. There haven't been a lot of treatment modalities for it. Maybe the patient's prescribed the medication, benzodiazepine to kind of, while they're having a panic attack, to calm themselves down. But more importantly, the reason we're really heavily focused on PTSD is we're really trying to help people understand PTSD is not just a combat-related disorder. It is a disorder that unfortunately is growing in the civilian sector of the population, especially when you take a look at all the wildfires that occur, natural disasters, and trauma symptoms. Trauma can occur in many forms, many shapes that impact people on a daily basis, including car accidents. So as we see this growing trend within the population, we want to make sure that we're helping individuals find different treatment solutions that kind of meet their needs. And our whole focus, as we look at where the company is today and where we want to go, our focus is really centered around the patient experience. And I'm not just saying that, we really, truly want to make sure that we're providing individuals opportunities to get access to care where they may not normally get it. That falls outside of the traditional norm. And we're not saying that the traditional norm isn't a great pathway. We completely believe in psychotherapy and medication, but those may not be the right options for each individual, or it may not fit into their needs in terms of where they are today. So we want to make sure that they have access to a multitude of treatment options. What's really unique about us is we're treating people in just 28 days. It's one and done. So they do the treatment at home for 28 days. They're paired up with a care coach for that 28 days to ensure they have good clinical outcomes. But we're teaching them a lifelong skill that they can carry with them on their daily living to help them manage through super anxious periods of time in their life and avoid the symptoms of either panic disorder or the physical symptoms that can be triggered by PTSD and episodes of trauma.
Talk me through the care coach a little bit, like the importance of having that care coach in this journey and, what type of stuff that care coach is typically doing.
Yeah, so we call them care specialists, and it's important to note, Jared, honestly, they're not providing any type of, they're not practicing any type of medicine. I love to refer to them as Sherpas. They're really there to help guide the patient through the 28 days, right? And the whole focus of them is they have weekly touch points with the individual patient to ensure that they're understanding what they're doing. Freespira is, our function is really addressing the breathing dysfunction that patients may experience, often caused by CO2 hypersensitivity. So it requires them to retrain the way they breathe. So the care coaches are meeting with them on a weekly basis, looking at the previous week's treatment sessions and ensuring that they're on task to achieve the goals that they need to. Throughout the 28 days, what's really fascinating about our product is the patient has a visual. So if we take a step back, there's three key ingredients we think that are important to the success of Freespira. The coaches are number one, right? They're there to guide the patient throughout the 28 days, be a partner for them, and help them, overcome any of the challenges that they may be seeing, either with the device or through the treatment process itself. The other piece is the visualization piece. For the first time ever, a patient that's suffering with these disorders can see how they're progressing. So throughout the 28 days, they're going to see on the tablet screen that they have in front of them how they're progressing in terms of normalizing their CO2 exhaled CO2 levels or respiration rate, and that's another motivating factor for the patient because it's the first time they can actually track their own progress.
I like that, by the way, a Sherpa.
Yeah.
Like, I like how you said that. Joe, you could work on anything. What is it about Freespira that gets you up every single day and want to build this company?
It's such a great question, and I think it's really, when I take a step back, what I'm really passionate about is improving access to care for individuals that are suffering from mental health or behavioral health disorders. And right now there are a lot of factors that are preventing people from getting care in this country for mental health care issues. Access to care and affordability are two things that I'm incredibly passionate about. Access to care, a lot of people don't realize this, but right now 50% of 50% of the people in the United States live in what's called a mental health provider shortage area. And what that means is that there may not be enough behavioral health specialists to help care for them. What's great about Freespira is our ability to take our product and deliver it directly to the patient at home where they can do this treatment on their own through the 28-day period really helps us overcome that first barrier, which is access to care in terms of a clinician. The second piece is the affordability factor. Even if you can find a clinician, whether or not they take your insurance is something else. And the out-of-pocket cost for mental health patients is significantly greater than anybody else that's seeking chronic care help for their chronic care conditions. So by our partnering with health plans to ensure that this is a reimbursed product, when we ship it to the patients and we enroll them, they already know up front that their insurance is covering it. So overcoming that affordability factor, we believe, will encourage people to come in and get treatment for the issues they're suffering from.
How do you see things going from here? Like, what are, I know you mentioned a little bit in terms of what's next. I like to always focus in on this from what you can share. I know you can't tell us everything, right, in terms of kind of what's on the horizon, but
Sure.
what what are potential roadblocks that you're like, are there certain regulations that you're watching right now, or bills that are coming out that maybe impact the business or space? um, I guess what excites you about the future opportunity, and then what also are you paying attention to from a regulatory perspective, or any potential roadblocks that could come up along the way?
Well, I think if you're in healthcare and you're not paying attention to what's happening right now with the change of administration, then you're probably not really in healthcare, right? So, from our perspective, I'll take the positive view. I think what we're really keeping a watchful eye on is we're seeing signs coming out with the changing administration where they really want to help embrace the adoption of digital treatments like Freespira. And the reason that's important to us is because the biggest roadblock we've had is just broad-based reimbursement coverage, right? And we do believe that people that are suffering from mental health disorders should have equal access to insurance coverage for the treatments that they need. So what we're seeing, and what I'm really hopeful and positive about, is, for lack of a better term, they want to equalize both the access. I'm sorry, equalize the approval process for new treatments, as well as combine that with a reimbursement structure in place. So when we look at it, they're pushing on the FDA to say, how do we fast track some of these non-pharmaceutical products to get them in the hands of individuals that need them? But importantly, they're also leaning on CMS to say, you have to create an equal pathway to get reimbursement for these products, because otherwise, if we don't have reimbursement, nobody's going to be able to utilize them. And we won't get enough of an adoption rate. So from our perspective, the future really relies on, over the next 5 years, our key focus is getting to a point where we have broad-based reimbursement for Freespira, so that regardless of where you are in the country, you'll be able to get access to it and it'll be paid for by your insurance company.
I like that. What's been some feedback that you've received so far?
If I may clarify, from what stakeholder, what perspective?
Any lens. It could be like, I'd love to hear. I know you have. I like to cover it from all from all potential stakeholders of the business. Kind of just give me a snippet. I know it kind of can differ, right? And investors' feedback is different from partner, but it can also be even from the team. Like, what's the level of excitement from the team in terms of what they're building? I kept it kind of vague. I want to hear kind of the different buckets, if that's cool.
That's fine. I'm just warning you. You get me started, I won't stop talking about it. All right. So
that's what I'm hoping. That's what
all
I'm
right,
hoping.
great.
Let's hear it.
Well, I think what's most important is, let's start with our health plan clients, right? We really form a partnership with them, and I think what we're hearing. In fact, we just did a webinar yesterday with one of our longest established customers in the Medicaid space. And what we hear from them is a few things. First is partnership, right? They really do see, when we approach this with them, we see ourselves as an extension of their brand. But one of the things that they shared with us is the amount of fee. So we hold these quarterly business meetings with them, and that's where the partnership really takes root, Jared, because we're sharing with them for the first time ever. They're getting actual clinical outcomes for the members that went through a treatment program, whether it's, so especially in mental health. So we're sharing with them on a quarterly basis actual clinical outcomes for the members that went through. We're also sharing with them patient satisfaction scores because we assign each health plan an NPS measurement that goes with the program. But most importantly, we share with them patient testimonials that they don't have access to previously, right? So they're hearing for the first time from a patient's perspective how difficult it was before Freespira, right, going through our treatment, how difficult it was for them to deal with these issues, and more importantly, the impact on the family. And I'm always moved by how impactful that is for the health plan, because you think of these health plans and the executives are so far removed from their members. When they actually see and hear the impact that, or the challenges that these individuals have suffered through, they really are, it changes their entire attitude around, getting them help. From a patient perspective, I think what we hear most often is life-changing. We hear that word so frequently, and many people come into it with kind of like a little skeptical, saying, all right, so I've tried all these other things, medications, nothing seems to work for me. Why is this going to work for me? To hear them at the end of the 28 days come back and say, this was life-changing for me. It really worked. And what we love to hear is how it's changed their life. So when we hear like patients who suffer from PTSD specifically, or even panic disorder, they're incredibly gifted at building avoidance behaviors. They never want to enter a situation that triggers their symptoms. When we hear stories about how they've been able to re-engage in family activities that they couldn't before because maybe they can't drive, they can't go to the movies with their daughter, and they share these stories about, hey, for the first time in 5 years, I was able to go to the movies with my daughter. I was able to get in the car and drive and see my grandchildren. That's when you realize you're on the right track and you're doing something important.
I like that. I like, one of the things I really liked before we hopped on the call
Mm-hmm.
is I go on your site and I see no medication.
Yeah.
Like clear as day. Although I started taking like supplement, I'm very like, but like those are, I view that much differently than like medications and things like
Sure.
that. Right. So I've always been someone that's kind of steered away from any type of medication. Like if there was a
Mm-hmm.
natural option, or like, um, I always investigated like my certain fruits and vegetables that I was
Mm-hmm.
eating if I wasn't feeling well, right? I think the approach that you're taking is very much with the times too, of people they want to avoid, medications, and they like these options way better. Just talk me through how you see things evolving now from here. Obviously, lots of progress, congratulations.
Thanks.
But what's kind of, where do you see Freespira in a few years from now?
Yeah, and I appreciate you sharing your personal views, right? And it's interesting because you mentioned supplements. I think it's important for me to say, like, I'm not anti-medication, but I think the
Mm-hmm.
difference in what you're saying is you're taking a proactive approach to your own healthcare, right? So you're at that precursor to that, and I believe in that myself. I do the same thing. I'm always looking for different ways that, whether it's me or my kids, trying to encourage them to take a more proactive approach, like using supplements, the right ones at the right times, makes sense. I think medications have a place in healthcare. I really do. And they've done some amazing things. But where I kind of start to differentiate is we have to provide people options, right? And I think we're at a point where we're seeing in society, people are saying, wait a second, I want to have the full I want to see the full menu of options in front of me in terms of what treatments are available, and let me pick the one that I think is going to be best for us. And I have, the way I look at things is I think we're at a point now where we have to change the mindset. I think oftentimes, especially in mental health, and I keep kind of anchoring around mental health because that's where I've been the last 12 years, but we tend to start with the standard of care, and the conversation sometimes ends there, right? Whether it's psychotherapy or medication. And I think that the mindset has to shift away from that is the first and only option to one that says, let me give you choices. And the minute we see an individual say, I don't think that's going to fit into my vision of what my treatment pathway should be, let's start talking about these other options. And the goal should be, how do we get somebody to engage in any form, any treatment as early as possible, right, and have a positive patient experience. Because what we've seen personally is once you get that individual into treatment, they have a good positive experience, they start engaging in other healthcare treatment options that will kind of continue them on that journey to wellness. So, from my perspective, you have to have a healthy balance, but let's meet the patient where they need to be met so that they can get the treatment they need and be and have a positive outcome.
Like it. I'm the same way. I'm not. I guess I'm not anti-medication.
Right.
I am anti. I had a grandfather that had basically heart wasn't in good shape, so he'd take heart medication. Heart medication killed the ended up killing the kidneys. Uh, and actually, wait, it was different. Had bad knees, had to
Mm.
take something. It impacted the heart. Then had to take the heart medication, which impacted the
Okay.
kidneys, which ultimately made him have to go on dialysis. And then the heart was so weak, and he was on dialysis that he couldn't get the knee surgery.
Yeah.
So I'm against medication when it has this kind of downward trickle down effect, which I think it's also very hard to navigate when you have a bunch of different issues and you
Yeah.
have to take certain things. But
Sure.
to your point, right? If we're being proactive, we can limit the bad use of medication and make it just for the necessary things.
Yeah, and I mean, let's just take a simple example. I agree with you. Like antibiotics are amazing; they've done amazing things. But how quick are people every time they're sick? I want an antibiotic, and like it's interesting now. The doctors are pushing back, saying it's not going to help you. I'm not going to write you the prescription. Where in the past, I think they would just write you the prescription to get you out of the office, right? So, and I think that's a healthy approach, giving people medications at the right time. And I've got two kids and they're both in college now. And the minute they're sick, they're like, so I'll go to the doctor and get an antibiotic. I'm like, you don't need an antibiotic for everything. Like ride it out a couple of days. Let's see how things are. And then if it doesn't get better in 2 to 3 days, that's when you go and you figure out if you need an antibiotic.
It could be a mental thing, but every time if I'm not feeling well,
Mm-hmm.
I take this shot of juice, and it's like orange juice, turmeric, ginger, cayenne pepper, and I
Sure.
shake it up in this like little bottle, and I take a shot of that like near the end of the day, midday, and then the next day. And again, I don't know if it's mental, but I feel great after. So, and that cayenne pepper burns.
Yeah.
It really, it's like a real shot. Um, but I'm gonna keep doing it. So it's funny. I asked AI, like I asked ChatGPT when I didn't feel well one time, what can I do that's not like medication? They
Right.
said, go take a shot of this stuff.
Wow. I was going to ask
And
you
it
if it was
wasn't
a
gonna hurt
homemade
me, right? It's a
concoction.
juice.
Well, I was going to ask you
Yeah,
if it's a
yeah.
homemade concoction, you should start bottling it up and selling it. There's a big need for that.
No,
Come on.
I've used a couple different brands. There's like that Suha, right?
Okay.
SUJA, and a few other ones. But no, I wish it was a homemade concoction. That would have been nice. Make my own. I can still make my own, right? That's
There you
the
go. Yeah.
the slice
I
of
like it
healthcare
though.
version. Uh, anyway, Joe, I want to thank you once again so much for coming on. You've been a ton of fun to chat with, and thanks for teaching us more about Freespira. Love what you're doing, and look forward to future conversations. And then, we're filming this before the event, but
Mhm.
also look forward to seeing you at the ATA conference in person. That'll be fun.
Hey, Jared, great to see you. Thank you so much. And thank you for taking an interest in letting us come on and share our story. And if anybody wants to learn more, just go to freespira.com. And there's a lot there. You've been to the website, and I think it'll help guide them through whatever they need. We're here to help.